Hi, my name is Dr. J. Michael Bennett. I'm with the Fawn Orthopedic Group. I'm a sports medicine fellowship trained surgeon specializing in shoulder, elbow, and knee. Today we're going to go over a brief overview of a couple new techniques that are out there regarding cartilage regeneration and cartilage healing. There are two different types of procedures now that you may see on the marketplace, and I just wanted to go over them briefly. One of them is called BioCartilage. This is made by Arthrex. And the idea is to stimulate new cartilage formation through using small microfracture holes in addition to using a cadaver cartilage cells, which would help create an overlay of new cartilage like healing over the defect. So if you look at a knee, basically you've got a defect of cartilage here, which is exposed bone. And there are certain patients that may be candidates for this. You can't do this in patients that have diffuse arthritis throughout the whole joint. It just doesn't work. You've got to have to be small isolated lesions in certain areas of the bone where you would be a candidate, and you cannot have arthritis on both sides. It has to be only on one side. So what we do is we go in arthroscopically and create little drill holes in that exposed bone. After we expose the underlying, remove the calcified layer and expose the underlying subchondral bone there. Once we create the drill holes, then sometimes you can do this arthroscopically or you can do it through a mini open approach. We go in and we actually inject a very pasty configuration of cartilage donor graft, which is from a cadaver, mixed with bone marrow aspirate, meaning that we take bone marrow from up here in your tibia, we suck out about 60 cc's of bone marrow, spin it down to get bone marrow aspirate concentrate, and those stem cells and bone marrow is mixed with this cartilage paste or this cartilage cadaver graft, and then we lay it into that defect. Okay, so now you've got cartilage cells mixed with stem cells, in addition to little drill holes that are actually little tunnels where more bone marrow is coming out. And then afterwards we put a glue type of surface, it's called fibrin glue, on top of that. And that creates, you're almost filling a pothole. And that creates a nice surface. And the thing about this is that you are creating a cartilage-like surface, but you're not getting a very quick recovery. You're gonna have to be protected weight bearing for a period of time, 6 weeks of non-weight bearing on that side, going to partial weight bearing, then full weight bearing. So you're still looking at about a 6-month recovery. This is not like a meniscectomy or just an outpatient knee scope. You still have a longer recovery with this, but because the fact that you're regenerating cells and getting cells to heal, you have to be protected for that period of time to allow this to solidify and actually become that cartilage-like material. Another option is something called DeNovo, which is the same thing. You have a large lesion here. You go in there arthroscopically. Once again, you clean the lesion, and again, it has to be an isolated lesion on one side of the condyle or the opposite condyle, but not on both sides and not throughout the whole joint. Remove the calcified layer, expose the bone, and instead of drilling the holes like in the last one was called a microfracture, which was part of the BioCartilage technique. This one, you do not drill holes. You leave that subchondral plate alone, and then you take the graft, which is actually live chondral cells. It's a juvenile chondral cells, so you actually have very, very immature chondrocytes or cartilage cells, and they come in a little pack, and they're like little cubes or little blocks, and we lay them in the defect. They spread them out all over the defect, and then we put the glue base on top of it again. Okay, and then again, it's the same type of post-operative protocol. You got to give it time to heal. You got to give it time for these cells to incorporate and actually grow across the defect. These are both very promising options. Oftentimes it's surgeon choice on what they prefer to use, whether it's the DeNovo or the BioCartilage. There are also some other videos that I did out there regarding other cartilage options, such as the osteochondral allograft and autograft option, or even the autologous chondrocyte implantation option. So I encourage you, if you want to look at those videos for more information regarding those two techniques. feel free to. But these are two newer techniques that now are being incorporated, so your surgeon may discuss these with you. If you have any further questions, please come by the office or go to our website at www.orthopedicsportsdoctor.com or www.jmichaelbennett.com. Thank you very much for watching.